there isn't any point at which a person will find recovery. We don't know. Are we? It's just that I don't know at what point you're going to be there. I don't know when you're going to be feeling this way or that way. I don't know. I don't know anything about the future. What I can promise you is that I'll be with you every step of that way. That's how I want to approach supporting a loved one. And I want to put into perspective that I'm with you. I
I love
can't
that.
do this for you. I can't do this for you. I can't give it to you as much as I wish that I could. I cannot. Right.
Another episode of the Speak Real podcast, sharing one-on-one conversations. We believe that storytelling is the best way to empower youth and give them the platform to find their voices.
Presented by YouthSpeak. Youth experience, youth voice, youth empowered.
Hi, everyone. Welcome to the YouthSpeak Speak Real podcast. Today we have Matthew Rico. Matthew Rico, I've actually had the pleasure of meeting him. I was actually in attendance for one of his training sessions. So it's really great that you're here. I'm really excited. Thank you so much for joining us today.
It's great to be here. Thank you for having me.
Yeah, Matthew, he's a mental health nurse, trainer, facilitator, and psychotherapist. So just to start out, could you tell us a little bit about your background in the mental health realm?
Absolutely. So my background trait is I'm a registered nurse. For over 11 years, I spent in working in mental health specifically, with experience working in forensics, floating around, working with youth. In total, I work at about 4 different hospitals, and I'm an instructor for a few different courses. Assessing and managing suicide risk is one of them. EMSR training from the Zero Suicide Institute, one of the first Canadian instructors for that comes from the US training. As well as teaching mental health first aid, where I met you, right? For myself with What Matters, and nonviolent crisis intervention training, but specifically with Safe Management Group that I've been doing for over 8 years for that as well. So there's a lot of my work has been in education. Besides, for that entire 11 plus years, it's been frontline care in mental health nursing. But over 8 years, I've spent doing trainings, educations, building a mindfulness workshop with a team meant for staff wellness, as well as conducting like research here and there and other types of projects.
That's amazing. It's really,
to summarize it.
wow, that's great to have like so many different experiences like that. So you can really bring that into your trainings and any speaking engagements that you come to. So I just think that's great. Thank you so much for being here. You sound very busy. So I appreciate you carving out the time and everything like that. Next question I wanted to know is, do you have any suggestions for helping a friend connect to resources without sort of being forceful? Like what I want us to be encouraging, and I'm wondering if you could give any tips on that.
So definitely, that's an excellent question. And one of the first things that I want to kind of talk about is that if for anyone that's listening, tuning in, if you're looking for tips on how to become an effective communicator, how to give support to somebody as a friend, you're already on the right track, right? You're already on the right track, because let's be honest, mental health stigma exists. We've done over a decade worth of anti-stigma campaigns with the Bell Let's Talk and all these independent organizations like YouthSpeak that are trying to get the word out there, trying to encourage people, give people skills, empower them, give awareness to certain topics. But it is still a very stigmatized field for many reasons, including cultural. And if you're looking to be a better support, you're already doing a great job, because it's such a challenging conversation and it's never going to go the same way each time for the same person. For different people, what one person's experience is not going to equate the same as another. Just because 2 people may have the same even diagnosis, the same problems, maybe similar life experiences, they're still going to be very different people, right? And those conversations can go very differently. So being a person's support, actually taking that courage and that vulnerability to enter those conversations, it's going to be anxiety provoking. It's going to be kind of scary sometimes. It's going to hurt, especially the more that you love somebody, it's going to really hurt. Being that person's support is number one. Having good supports in a person's life is one of the main predictors that someone's going to do well with their life. Now, tips and strategies besides just having those conversations, being open to them, is that we want to stay as far away from advice giving as possible. It's never helped.
Right.
There are so many examples I can think of. If you were to look at any person who's been trying to make changes in their lives, but they're kind of maybe ambivalent about them, where you tell somebody what they need to do or how great they are, without talking about any topic specifically, advice giving doesn't usually work. It can be kind of annoying sometimes, but it's one of the last things that you really want to be doing. Of course, unless a person's actively seeking your help. Like if someone's saying, I really want to quit smoking, the Nicorette's not really helping. I've been trying to use that gum and the patches. Do you have any other tips for me? Because I know that you quit in the past. Right. Yes, give them advice because they're already motivated and trying to get help. But just being a good listener is the most important. Being an effective listener and not giving advice. You may have already there's a chance that you've already heard this before. What I want to say to that, because a lot of people, this is not new news to be hearing about being a good listener and empathizing. What I want to say to that is that quite often when people are still looking for more, they don't feel like they're doing anything. They feel like I have to be able to help my loved one, my friend, more than just listening to them. One of the other pieces to listening, to being a good listener, is being able to reflect with them, which reassures them that not only you're listening, it can also help them to reflect as well. If I were to talk about how overwhelming something is, when they're explaining all the different things going on in their life, and I were to talk about how overwhelming that is, and how do you even prioritize any of that because you're pulled in so many different directions, that might help that person to reflect too and say, that's what I've been feeling. I just couldn't really put a word to it. I don't know what to prioritize. I feel like everything's important, but I'm drowning. There's just so much asked of me. I don't know how to navigate this. The other piece to that, besides listening and reflecting, is the validation piece. Validation is extremely important. Whether we're talking somebody, changing their views, maybe they have very stigmatized beliefs about mental health, or whether we're talking about somebody that's been through a traumatic situation, or we're talking about, a person who is even just trying to, get over like a breakup, for example. In all those situations, there has to be a certain level of acceptance and validation. If a person blames themselves for something, if they feel that there's things that they could have done, that things shouldn't have gone a certain way, that why is it like this? They just have all these questions in their head, this blame against them that's rejecting reality. They're going to have a hard time moving forward. I think it's fair to say that people can't logic their way into healing. There's a lot more to that, and people really need to come to a terms of acceptance. And how you're going to help people through that is through validation. Validate everything.
Right. As someone with lived experience myself, I have always appreciated validation. And as someone with lived experience, I always want to be there to help a friend. And you just saying that, just being there, them knowing that you're there for them, is doing a really great job. I find that very comforting. So thank you so much for that.
My pleasure. I mean it. And I'm glad that you were being vulnerable and opening up about that, because it just really reinforces that what I'm saying is true.
Do you have any suggestions when you want to help connect a friend to resources, specifically? Like, what's a good way to present them?
First things first is that safety trumps everything. If there's ever an emergency risk, you have to find some kind of professional supports right away. There's more and more resources coming out there. You're seeing even the Greater Toronto area is adopting more crisis services that are also not involving police as well,
I've
that are
noticed
involving
that.
clinicians. So it's looking better. The reason why I'm saying that is because at the end of the day, safety trumps everything. Safety trumps confidentiality. Safety trumps everything because you want them to be alive, right?
That makes
And
sense.
safe.
Right.
Now, what if a person is not wanting to get to supports without getting too much into it, because this is actually a very large question. I would encourage people to look into motivational interviewing, and I would encourage people to look into the stages of change. They're not very complex models. They make a huge difference though. Now, on top of that, I'll kind of talk briefly about what I mentioned is that people aren't always going to be in the same place to be making a change or to be seeking support or accessing resources. That's why you might get some pushback, because I think that was part of the question, is because somebody doesn't necessarily want to get support, right? It's kind of how I understood that. Because if somebody's already saying, I need these resources, I need these supports, then we would just look for them. We would Google them. We could look at CMHA's website, hospital websites. We can call crisis lines. If you're supporting somebody, you're not even from their area and you don't know what supports there are, call the local crisis line there, because the crisis lines will have a list of resources and supports that the person can access. If you really don't know, crisis lines are an amazing resource that should be utilized a lot more. They can be kind of scary. So if you're supporting somebody and you ever don't know what to do, but it hasn't gotten to the point that you're going to call emergency services, use a crisis line. If they're saying, well, I don't really feel really comfortable talking to them, we'll put them on speakerphone. I'll talk to them. I'll ask them advice. If you want to chime in, that's your call. Let's do that. Because they have experience, they have support, they have training in being able to help people through mental health problems. Mm-hmm. So definitely use them. Now, when I said people aren't necessarily always in the same place to be making a change, what I mean by that is that if you were to look at the stages of change, there's different areas, right? There's different kind of steps where people are, where they're kind of ambivalent about the change, their readiness, their preparedness to make the change, to take action. How consistent have they been with taking action? It's gonna range from being that whole idea of ignorance is bliss, like I don't really acknowledge that there's a problem to begin with, all the way down to relapse and maintenance, where a person has been, seeking support, going along with treatment, following their plan, their homework assignments, practicing skills that they learn. So if you're meeting resistance, very often what's happening there, and I'll talk about two different kind of scenarios. One of them is easy, so I'll get it out of the way right now, is that if a person has relapsed, again, empathy validation. Because the likelihood of them being right back in not acknowledging that there's a problem is very unlikely. They've already made changes. They've already acknowledged that there's a problem. It's just they've relapsed. So some suggestions for helping somebody who's relapsed is letting them know that relapse is very common. On average, people will relapse about 7 times in their life. Reminding them that there are perfectly valid reasons why they may have relapsed, even if they disagree with them. They may say, I shouldn't have hung out with this person. I shouldn't have done this. I should have kept taking this. It makes sense. Something happened. Maybe you're under stress. Maybe it was peer pressure. Maybe something else happened, but they need that validation so that they can get back onto the plan. And if they say the plan's not working, it's like, well, it worked for this amount of time. Let's tweak it a bit, because obviously it was working. So that's why that one is a lot easier, because they've already been motivated in the past. It's just getting them back on the bandwagon. The next scenario is a person who's kind of more resistant. They're more likely to be very early into not even acknowledging that there's a problem to begin with. And if they're not acknowledging that there's a problem to begin with, a lot of the focus should be on helping them to reflect on what's happening in their life. What do they believe that their problems are, getting them to really think it through, and then exploring the options, just exploring what would happen if they were to access this, if they were to do this, what's their interpretation of it. Because we can jump to conclusions all we like about why is a person not accessing resources. We're not necessarily going to know the full picture, right? Very often people can even stigmatize and judge people for not seeking treatment as being lazy, as not helping themselves. May use terms like they're doing it to themselves, that they're the problem, right? But
That's so harmful.
It's very harmful, very, very harmful. So the more that we learn about why a person is doing the things that they're doing, why they are not accessing services, what their interpretation of everything is, we the more that we learn about them, the picture becomes a lot clearer, and then we can help them to access those resources, right?
That's great. I really loved that tip about calling the crisis line and saying, if you don't want to speak to them directly, we can put them on speaker, just making them feel more comfortable, and also just not making assumptions about why they haven't reached out. It sounds that you're centering the person, and I think that's so important. What you said about stigma as well, reducing the stigma of, this person has gone on with this issue for this long. Me personally, I would feel very comfortable if a friend came to me with that perspective. So thank you so much for sharing that. I really, really appreciate it. And I'm wondering if you have any stories about maybe a friend or a patient or somebody you knew receiving the help they need because of an encouraging friend or acquaintance in their life.
So that's a good question. I can think of a couple stories that might be helpful and encouraging, and they also align with the themes that I was talking about. So people will be ready to make a change when they are ready, and we can help them to come to those conclusions. We can help to gently alleviate stigma and encourage them to access supports, but the timeline will be different for everybody. So I'll give you a few examples. One person who was a young patient, he talked about how he didn't want to seek treatment, and the only reason why he sought treatment was because his friends came over to his condo and they all took turns spending time and watching him. And they would play games together, they would joke around together, but they basically took shifts. And this went on for over a week. And they got to the point where he said that he wants to get better for his friends. He's like, I couldn't keep them here. They were taking time off work, they were taking personal leaves, they just wanted to keep me around. And I really refused to go to get help and treatment. And I refused to have them call 911. I told them I'd be really upset with them. So their middle ground was just to keep me alive, was to watch me.
Wow.
And that inspired him to get ready. He was so overwhelmed with pride and joy. He's like, I have the best friends, is what he said. I have the best friends. Now, not everybody has supports like that. That's why supports are so important. Finding those supports, building those relationships is going to be important for somebody to have a good life. Another example that I can think of is a friend of mine is a very machismo type. We would go to boxing, or we'd go to the gym together, and wasn't very open to being vulnerable, wouldn't really talk much about mental health. And he might allure to things here and there about how he was feeling. And when he finally decided to tell me that he was actually feeling quite suicidal over the last couple months, and I noticed that he was off, a lot of it was listening to him and spending time validating that none of that makes him weak, right? But not doing so in a way that was patronizing, because we have to be mindful of, since we're on the topic, we're talking about friends, you're not their therapist, you're not a doctor. So we want to be very careful about the words that we use. We're still talking to our friends at the end of the day. So our choice of language shouldn't change. how we approach them is what we want to focus on. Is I want to focus on listening and validating and being genuinely curious. I don't want to use certain buzzwords, like letting him know that he has a safe place with me. That might be very helpful for a client, for example, but for a friend that we joke around all the time, he might be like, why'd you use the word safe space? You sound like a doctor right now. Right. So I might say, this is not going to go anywhere. It's just going to be between me and you, bro. And he's like, thanks, I appreciate that. It's the same thing.
You're still with your friend in that
You're still with your friend. I'm not going to judge you, man. Come on. I'm not going to judge you. It's like, dude, you lift more than me. It's like, how can you say things like that, that you're weak or you're being a wuss? Like maybe you might joke about that, but that's not something, you might hear from necessarily somebody in a professional role in an environment, right?
Right. That language piece makes so much sense. And it really it sounds that like, your role is not as a professional, but just being there for somebody can make a massive difference.
Absolutely.
So yeah, that's those are some really great examples. So thank you so much. I also wanted to know, how could I, as an individual, support a culture where people feel safe about sharing without facing stigma?
Being very careful about what you say. And that is as important as watching the words that we use. So things like successful, right? When it comes to I'm not going to talk too much about it, but for example, like saying successful suicide, or failed attempt, you wouldn't say that. There's no failure success. Rather than saying that person is schizophrenic, let's use person first language. Like you wouldn't say, you wouldn't want that person to just be schizophrenic. Like that's not them. They're still like Matt or Bob or whoever. So adjusting our language is huge, and being careful about what we say. So for example, if I were to be making, even if I don't have any stigmatized beliefs, but we're making a joke about depression, the odds are is that anybody in that area hearing me joking around about depression, they're never going to come to me, because they're thinking like, Matt was just making fun of this. There's no way I would feel safe opening up to him about it. He's gonna be making what's to stop him from making fun of me, even if I don't feel that way. So it's easy to say, like, just be careful about what you say. People might say, come on, people are, maybe they're being sensitive, or it's like, I was just joking around. Intent only goes so far. Remember that's part of, of accepting life and reality is that intent only goes so far. You can intend all you want to show a person, the best date. Doesn't mean that it's going to become a relationship. You can intend to be as polite as possible and not offend a person, and you really care about them, but you might have said something that just hit them in the wrong way, or maybe it was a little insensitive, or maybe you were ignorant about the topic or the subject, or you went a little too far. Just because you didn't intend to do it doesn't mean that it's not going to happen. So on that note, a genuine apology is always really important as well. So if you ever, part of creating that safe space is not giving a backhanded apology. Well, it's like, well, I'm sorry you took it that way, right? Or, I didn't think you were so sensitive about that.
When it's the worst, I'm sorry you took it that way.
Those are, yeah, I'm sorry you took it that way, right? Just a genuine apology. I'm sorry. I'm so sorry. That wasn't my intention. I will do better. And I've even said, like, somebody just recently said, it's in the notes. I really don't want to talk about that. I don't appreciate you asking me about that. And, at first you might think, wow, you're just trying to help the person. It seems like they were kind of being a little bit rude to you. To me, they're expressing their boundary. Right. And I thank them for that. I says, you know what? You're absolutely right. I haven't had you for very long. I've only been on shift. I haven't had you at all. I've only been on shift for half an hour. I appreciate you sharing that boundary with me, honestly. And I will, do my best to keep this safe. If there's anything that you're not comfortable with or you don't want to answer, absolutely. I hope that you keep telling me, because that's all I want, is for us to have a good conversation. And they were receptive to that, right? It's so, if somebody's telling you they were upset, it's not about you, right? So right. A genuine apology is important, right? And then just committing to do better. So not talking about anything, bad or anything stigmatizing, being careful about what we say openly in public, even if we're just joking around, that can lead to further creating a not safe space, as well as making sure that we apologize should we ever offend.
Right. So if someone says that you hurt them, believe them. If someone brings up a boundary, respect it. It makes a lot of sense. And I personally, I would hate for my language to ever make anyone feel like I would cause them harm, or that I've already caused them harm with my use of language. So it's really something on my mind that I really need to think about things before I say them. And using person first language, for example, is something that I always make sure to do. It makes a lot of sense. Sometimes we really need that reinforcement. So thank you. And
my pleasure.
Still on that topic, when we are talking to a friend who's going through something with their mental health, how could we respect our own boundaries and engage in self-care as well for our own mental health?
So something that's important for our own boundaries and part of self-care is accepting the limits of what we're able to do. We need to readily accept, what our own capacity is, and that there's only so much that we can do, simply because it's going to be harder to cope when things aren't going the way that you'd want them to. Whether the person doesn't acknowledge that there's a problem, whether they aren't seeking treatment, whether they've relapsed and they're not, getting back onto their original plan. It can be very hard if you, again, the more that you love the person, the closer they are to you in your life, it is going to be naturally hard to watch them suffer, basically, right? So on that note, a few reminders that might be helpful for practicing acceptance is putting it into objective reality. So the reality is that might be helpful. A few different reality facts is that if we look at medication, if we look at therapy, we look at the groups, we look at the treatment centers, I don't think we've cured mental illness. We haven't. There's so many people, majority of people, more than half of people are on antidepressants in North America. Wow. Yet has antidepressants cured depression? No, it hasn't. So we know that mental health is important. We know that mental illness is a long journey. It's a lifetime journey, and people are going to have ups and downs. And because it's something that we can't easily put a cast on, can't just take a pain pill for, we can't just, take a puffer. It's hard. It's hard because there's no quick fix. And remembering that can be helpful. That the best that we can do is what's within our own capability. Like, I can do my best to have good times with them, to be connected with them, to be a good listener to them, to be there should, they ever fall. I can't, just like there's no doctor or treatment center in the world can't prescribe wellness. They can't prescribe happiness. Nobody can hand it to you. Neither can you. So being with them is all you can do, and it's the best thing you can do. So if you put that into perspective, that can help people to cope. One analogy metaphor that I like is the idea that this person may be like visiting you in your home out in the middle of nowhere, and they may want to explore. They may have an adventurous spirit. They may want to see different places. You may have some tips and pointers saying, the swamp might not be a good place, or this place is full of wolves or something, but they may venture there anyways. And they may fall, they may get bit, they may be out late at night, they may be covered in mud, they may be covered with scrapes and bruises. But what that person that you're supporting just needs to have and to know is that they can come home to you. You want to be like home to that person, right? It's that at the end of the day, can I come home to rest? Can I come home to a reliable support? Can I come home to somebody that isn't going to judge me for venturing too far? Can I come here at 7 p.m.? Can I come here at 3 a.m.? Right? Now, your boundaries are going to differ for everybody. So you may not be somebody that can, especially if you work like a Monday to Friday job, you might have kids. You can't have people calling you all the time at like 2, 3 in the morning. And just as an example, right? So making sure that you have good boundaries about what is acceptable and what's not, I mean, except for emergency situations, as an example. So that's something that everybody has to explore on their own, and what you are fine with, like what you are actually comfortable with, without any kind of guilt. Like don't guilt yourself. You want to do the best that you can with what you have and what you're capable of. Just because somebody might be open to doing something one way doesn't mean that you can. Besides, different life situations, there's even just at the very basics, introversion versus extroversion, right? Someone who's more introverted is going to have less of a social battery, smaller social battery than someone who's more extroverted. I'm very extroverted. That's why I work at 4 different hospitals, and I'm constantly doing this. But somebody who's more introverted, they won't have the same battery that I do. And that's just a natural thing. So, there isn't any point at which a person will find recovery. We don't know. It's just that I don't know at what point you're going to be there. I don't know when you're going to be feeling this way or that way. I don't know. I don't know anything about the future. What I can promise you is that I'll be with you every step of that way. That's how I want to approach supporting a loved one. And I want to put into perspective that I'm with you. I can't do this for you. I can't do this for you. I can't give it to you as much as I wish that I could. I cannot, right?
There's that feeling that you wish you had a magic wand of some sort.
Yeah, we all do, right? Nobody likes to see their loved one suffer.
Right. And it's not like other like ailments that someone might have where you can go get a blood test and here's your antibiotics. But I really love how you put that they always feel like there's like a home to come to, or, someone along the way. And it sounds like it's very much a journey, but just knowing that someone's there to support them can make a huge difference. So I really loved that analogy, and I'll definitely use that. So
yeah, definitely. I haven't copyrighted, so it's definitely okay.
What is the number one takeaway that you want people to leave with from this interview?
The number one takeaway is that every skill that you learn is meant to further empower you. And every skill that you learn, you need to practice to be good with it. At the bare minimum, just be a good listener. Be a good listener, be a good support, be genuinely curious, stay as neutral as possible. Don't give advice, right? Just be a good listener, right? That's extremely important. Simply because they get caught up with, I don't know how to help you. What do you even say to this? Right? I don't know how to fix your problems, or it's like I've given you advice and you're not listening. So if you look at all the complaints that people generally have that put them off supporting somebody with mental health problems, they all have to do with that person feeling powerless for the most part, right? They feel powerless, they feel helpless, they feel frustrated. It's like it's the same problem over again, and it's going to be. So it's because again, it's exactly like you said, it's a journey, right? So just be a good listener. Just be a good listener. And part of that boundaries that I didn't talk about that could be helpful in you building is telling people how much time you have. If you don't have a lot of time, because you can imagine, for anybody that's ever supported somebody through mental health problems, these can be very long conversations. You might be talking to somebody for hours. So if you do not actually have that time, you still want to be a support, but at the same time, you don't have the time. It doesn't have to be either you support them or you don't. It's either I support them and then we talk for like 3-4 hours, or I just like protect my own energy. There are gray areas in between. There's middle ground. It's like, hey, it's great to hear from you. It's like, definitely, I want to talk to you. So I have to be, making dinner and with my kids in an hour. So I have about 30 minutes to talk. Is that okay? I want to be there for you. Let's focus on that. And he says, yeah. And then they start to talk. you be mindful of the time. You might say, okay, so I got about 10 minutes left and I'm really sorry. Again, genuine apology. I'm really sorry to cut you off because it sucks. It sucks to cut people off. What is the most important thing right now? I understand this, and this. What is the most important thing that you want to tell me right now? Just so that we can focus on that, because the last thing I want is that I have to go and, we haven't gotten to the most important piece. And then when they start to talk and then you support and you empathize, you reflect, it says, that makes sense. Again, with the validation, everybody needs to know that they're not crazy for feeling a certain way, right? That it's normal. These are normal responses to abnormal events is how we like to coin it. A person who is jumpy and scared because something traumatic happened. Yeah, that makes sense. If you've been through trauma, if bad things have happened, if you've lost your job, if somebody's passed away, if any bad situation happens, it makes sense that you're sad. It's a reflection of how much they meant to you, right? Or what the loss is like. To be confused, to be anxious, to be scared. These are all very valid feelings. The last thing anybody ever needs to feel is crazy or wrong for feeling the way that they do. So just being a good listener, again, is important in validation. And managing your time and your energy with boundaries. Boundaries is very, very important. We could talk about that all day. Explore your own boundaries. It's an easy Google search as well, and work on them, build them up, because it doesn't have to be this or that. There's a lot of gray in between. So be aware of your boundaries, be a good listener, continue to support people. Those are kind of the main takeaways I think I want people to have from this.
I definitely took that away from the certification that I did with you. You're just such a wealth of information and important information. I was wondering if you could talk a little bit about your course offerings and your website before we end off. Sure.
So my website is What Matters, but without the E. So it's WhatMatters.com. It's a play off of my name because my name is Matthew Rico, Matt R. So, but mental health and matters, right? So we talk about mental health, and that's the main topic. The main course that's offered besides AMSR is Mental Health First Aid. It's just a very good, complete course. So I am an official certified trainer from the Mental Health Commission of Canada. There are many trainers that have the course offering. So definitely we all teach the same content. We kind of add a little bit from our own experiences. So from my experiences, as you can kind of tell, like I have, stories and some of the information on the neuroscience behind things, why people do, examples, analogies, stories, metaphors. So if anybody likes how I present information, then definitely I'd love to see you in one of my classes. But that's the main difference. It's that each trainer just kind of has their own personality, their own experiences and stories, so, and their own approach. But the content, the skills is the same. I talk a little bit more about other things, like even skills and stuff here and there, but that's what to expect.
Right. I like that. Well, thank you so much for this very enlightening conversation. I really appreciate that you carved the time out for it.
My pleasure.
I'm learning so much. So yeah, I hope you have a really great rest of your day. And thank you so much again.
Thank you. It was great to see you again. All the best to you. And thank you for everything that you're doing. Right. And thank for you. Everybody else that's listening and tuning in. Honestly, I wish everybody that I've interacted with had someone like you out there. Right. In all honesty, a lot of people are alone. There are people that we rely on volunteers to see them regularly. So the fact that you are supporting somebody, you're choosing to support somebody is enormous. So thank you for everybody. And again, thank you for this opportunity to share some skills.
If you want to hear more stories, don't forget to subscribe, comment, and like. To support more youth by youth-led projects, visit us at youthspeak.ca, where you can donate and spread youth mental health awareness.
YouthSpeak Charity. Speak, inspire, change.